Yeah, use
Perfect,
the shoulder. Okay, sorry. So for small intestine 9, we just have the arm in the adducted position like this, yeah. And this is the end of her posterior axillary crease. So we just go about one cent up from the end of the posterior axillary crease, okay, to about here, and we try to be like vertically above it this way. SI9 is right here. This is the true shoulder point, yeah. And then for SI10, we go straight up from SI9 until until we stop up against this bone right here. Okay, this is the lateral end of that scapular spine.
Is that right next to the big bone? Great bone? The SI something is on the other side of the crevice?
It's by the true head of
Like
the
16 or 17.
Yeah, it's. I think. I'm not sure which point that you're talking about. Oh, the acromion.
There's a point there in it.
Oh, okay. Yeah.
SI
Well,
something.
but that point is
Large.
above the scapular spine,
Yeah.
so
Oh, okay.
we're below it.
Underneath.
Yeah. Just below it. Okay. So SI9, SI10, straight above it. Yeah. And then, okay. I'm just gonna mark some things. Okay, so
give you a reference point.
yeah.
Inferior.
So
Posterior.
we're gonna locate small intestine 11. So, we wanna define where the midpoint of the scapular spine is. Yeah, that actually can be kind of hard to do sometimes because one thing it's a little bit crooked. I mean, it goes up in this way. Yeah, this is like the medial edge of it right here, and if I roll across, I'm feeling it this way. Eventually goes here. So these are the two endpoints. This is going to be the midpoint right here of the inferior edge of the scapular spine, right? And then that's one endpoint of that line, and then the other endpoint is going to be the inferior angle. So yeah.
Yeah,
So you
perfect.
try to feel for the point of the scapula. So it comes down this way to this point here. Okay. This is the inferior angle of the scapula. Let's see. And try to find the actual bottom of it. Okay. Inferior angle. Okay, so these are the two endpoints of the line, and we divide this into thirds, yeah? And yeah, the upper third is where we're gonna find our SI11 heavenly gathering, the Tianzong, okay? So 1/3 and 2/3, okay? So it should be in the,
Is
yeah.
there an equilateral triangle?
Oh, okay, yeah, this one is actually,
It's a circle.
yeah. This actually seems like a little bit lower, yeah? Because if it was an equilateral triangle, it would be higher up here.
So you
Yeah.
But
Might-
yeah.
Yeah.
Would depend on the person then.
put it.
Yeah. Right. This is a
11.
little tender, yeah? Okay. Yeah, I'm sorry.
That's okay. No, it feels like
Okay, so
perfect.
on the
Thank you.
infraspinatus.
Yeah. Give you a little massage.
Okay.
Acupressure. Finger in there.
Okay. So the next point is our small intestine 12, the Bing Fong, the grasping the wind. So from SI11, we just slide straight up. We're gonna hit the supra scapular spine, and we just keep going up over that that bony ridge into the suprascapular fossa. And this will be SI12 right here. Okay. So 9, 10, 9, 10, 11, 12. Yeah. Okay. And then 13 is going to be on the medial end of this suprascapular fossa. So you know, again, you can kind of feel for the medial end of it. This will be like SI13 right here. Okay. And it should be a little bit below SI12 because if you remember, the scapula is kind of, it's not going straight across this way, it kind of goes this way. So SI12 is above the scapular spine. SI13 is also above it, but because scapular spine goes down, angles down this way, you're going to be a little bit lower. Okay, so this is SI12, SI13. And then if you remember, SI13 should be midway between T2 and small intestine 10. Yeah. So we can try to practice finding our palpating our spinous processes. So I slide down the back of the neck until I feel the most prominent vertebrae. If I'm not sure, I'm gonna ask you to, I'm gonna have you turn your head side to side. Okay, so let's see. Put that on a little bit more. Okay. Okay, one more time. Okay, this kind of remains mobile. Okay. Yeah. This is so that one is T1 and then this is like T2. About right here. This is the actual spinous process. So yeah, it does look kind of midway. Yeah, this is SI10 right here. This is T2 and then about halfway between is where SI13 is. Okay. Okay, so that's SI13. SI14 is going to be level with the spinous process of T1, okay, and it's going to be 3 syn lateral. So let's see, keep losing it again. Sorry.
Was it from the base or the?
Okay, so SI13, you find the actual spinous process as your landmark. Okay, but the other points you use the lower border. So SI14, yeah. Right now I'm on T1. I go below it, below the spinous process until I fall into this slight depression. This is between T1 and T2. Okay, so this is the lower border of T1, and I go 3 syn lateral. So I'm using this as an approximation, but this will be my 3 syn. I go straight across this way, and this will be about 3 syn.
So straight across that.
Yeah, like lateral, 3 syn lateral to lower border of T1. Okay, and you can kind of check, you know, this right here is the medial edge of her scapula, yeah? This is like 3 syn right here, okay? Okay, and then